Welcome to the USMLE High Yield Bites. Imagine this: a 45-year-old patient comes to you complaining of early morning awakenings and feeling unrested despite sleeping 8 hours. Could this be a clue to step 1 question on sleep architecture? Absolutely. Today we are breaking down the factors that alter sleep patterns. Key knowledge for nailing neuro and psych questions on USMLE Step 1. Let's dive into how substances, aging, depression, and narcolepsy affects the sleep. First, let's talk about substances and aging. Alcohol, benzodiazepines, and barbiturates all have a big impact on sleep architecture. They decreases the stage N3, which is your slow wave deep sleep, and they also reduce REM sleep. This means less restorative sleep and fewer dreams. Interestingly, benzodiazepines have a clinical use here. They're helpful for managing sleepwalking and night terrors, which also occurs in N3. So if a step 1 question describes a patient with night terrors calmed by medication, think benzodiazepines. Now, let's talk about aging. As we get older, sleep changes significantly. There is a decrease in both N3 and REM sleep, meaning less sleep, restorative sleep, and fewer dream-filled REM cycles. On top of that, aging increases the sleep onset latency, meaning it takes longer to fall asleep and leads to early morning awakenings. Picture an elderly patient waking up at 4 a.m. unable to fall back asleep. That's a classical aging sleep pattern on step 1. The key takeaway for USMLE: substances suppresses deep sleep and REM, while aging disrupts overall sleep efficiency. These are high yield for questions on sleep disturbances. Now, next, let's look at the depression and narcolepsy. Depression has a distinct sleep profile that's a favorite on step 1. It decreases N3 sleep, so less of that restorative deep sleep, but increases the REM sleep. Meaning more time dreaming. Also decreases the REM latency, so patients enter REM faster than normal. On top of that, depression causes repeated nighttime awakenings and early morning awakenings, often called terminal insomnia. Think of a patient waking up at 3 a.m., unable to sleep and feeling unrested. That's a classic depression sleep pattern for step 1. Now, narcolepsy. The hallmark here is a decreased REM latency. Patients enter REM sleep much earlier than normal, sometimes within minutes of falling asleep. This rapid REM entry leads to symptoms like sleep attacks and cataplexy, where sudden muscle weakness occurs, often triggered by emotion. If a step 1 vignette describes a patient falling asleep during the day and collapsing when laughing, narcolepsy should be on your radar. The key for USMLE: depression means more REM, less deep sleep, and terminal insomnia. Narcolepsy means a rapid REM entry with symptoms like cataplexy. That's your high yield rundown on factors affecting the sleep architecture for USMLE Step 1. From substances to aging, depression, and narcolepsy, these patterns will help you tackle sleep related questions with confidence. If you found this helpful, give us a like and subscribe for more USMLE bites to ace your exam. Good luck.